Welcome back. In our last video, we talked about the hip flexors and in particular the psoas muscle. We said that the psoas muscle attaches from the lower spine down through the pelvis to the upper part of the thigh bone. We talked about how prolonged sitting can actually shorten that muscle, which can pull on the lower spine, and it can lead to stiffness and or even back pain, lower back pain in particular. We talked about how important it was to not spend too long sitting. I also mentioned that I could show you some very simple exercises in order to isolate and stretch the psoas muscle. Before I get into that, I do want to mention there's one other thing that we need to be aware of. Because of where the psoas muscle attaches and where it runs, since it attaches into the upper part of the thigh, when it shortens, it can also cause the femur or your thigh bone to rotate inward a little bit. When that happens, that can lead to issues with the knee over time. It can even lead to issues with the ankle and or with the feet. A lot of people will tell me, gosh, doc, I didn't do anything, but I seem to have this issue with my lower back, and I also seem to have this issue with my knee. They very well could be related. So, a very, very simple stretch for the psoas that a lot of people can perform is simply bringing up the foot. You may need to support yourself on a chair or a table or something. You want to try and bring the heel to the buttocks. Keep the upper body straight, and then you attempt to bring the knee back. Now, that can stretch the psoas pretty nicely. Many people say they feel it in their quadricep or their thigh before they feel it in the hip flexor. That is normal, and you may, on a gradient, move up to being able to pull further to where you feel it in the hip flexor. Another way to isolate this very simply is to get into a position similar to a lunge. Once again, you may need to support yourself on something. The idea is to try to keep the back leg straight and the heel on the floor. And much like doing a lunge, you're simply going to sit down or squat down. And again, this is just like doing a lunge. You want to make sure the knee does not go forward over the toes because we don't want to create any knee problems. But once again, we want to keep the torso upright. And as you drop down, you can feel that, or should feel that, isolating that hip flexor. Now, since we have a psoas and a hip flexor on both sides, we want to do the same sort of thing on the other side. So, we do want to work on stretching both. There's a lot of debate. What is the best way to stretch? How long should I hold it? That type of thing. What I typically suggest to people is once you get into that position, as you feel that stretch, try to hold it for 15 to 20 seconds. You can relax and you can repeat it 2 to 3 times. Okay? As I mentioned, the psoas can be a problem when we spend too much time sitting. It's important not to sit too long because that puts 10 times the pressure on the lower spine as standing. At the same time, if you're forced to sit at a computer, which many of us are required to do these days, it is very, very important that we make sure the hip flexors are flexible, and hopefully those stretches will help you handle that. Until the next time, stay healthy.